My name is Chris Cartlidge. I'm a consultant oncoplastic and cosmetic breast surgeon. I work in the NHS, but also in the private sector, where I undertake treatment of all types of breast disease, including breast reconstruction from cancer, but also undertake cosmetic breast surgery. And the majority of that for me is breast implant augmentation to enlarge the breasts and breast reduction surgery to reduce the size of the breasts. I also undertake breast uplift for ladies who are looking for their breasts to be moved to a higher, more youthful position. When you get a breast implant augmentation, the most usual thing is for the implants to be put in using a small incision in the crease of the lower breast. The implants themselves are then placed underneath the breast, and there's two more common ways to do that. The one that I usually use is to partially cover the implants with the muscle from the top of the chest. In some situations that's not appropriate, for instance in ladies who are very physically active, and in that case we can put the implants directly behind the breast itself. Now in terms of what happens to the breast, obviously you're putting in an implant which has quite a significant amount of volume, typically around 250 to 350 cc's of volume. So that pushes the breast, it pushes the pre-existing breast forwards and upwards, and it gives the overall bust a much fuller look and enlarges the breasts so that you would move from a smaller cup size to a larger cup size. Now when that happens, it causes a degree of stretching of the breast tissue. There can be some numbness and tingling in the skin over the top of the breast or in the nipples. Normally that settles down, but that can take several months to do so. In terms of the length of time for breast implants to settle, I find that it is generally around the 3-month mark that the breast implants undergo what we call the drop and fluff. And effectively what this is the breast movement, the breast implants lower themselves slightly and move into a more natural position in the chest. And you go from having quite tight breasts that can feel a bit uncomfortable at times to them feeling as if they're in a more settled, natural position. One of the really important things as a surgeon is making sure that when you do the operation that you accurately define the bottom part of the breast tissue. So whenever I do a breast augmentation, I'm always making sure that I've got a clear idea of where I want the lower crease of the breast to be. And that means that when the breast implants lower, that they do so in a controlled manner. But usually it's from about 3 to 6 months that things settle down. And often it's at that point that my patients contact me to say that everything feels much more natural and they're feeling much more comfortable going about their usual activities. Gone are the days when we used to tell our patients that breast implants lasted for 10 years and they had to get them changed. 10 years might have been a good rule of thumb in the past, but the types of implants that most surgeons, and certainly that I put in nowadays, don't have any fixed length of time after which they would have to be changed. So it may be that you have breast implants put in and that you don't require any further surgery or any change of implants for the rest of your life, whether that be 40 or 50 years. What we do find though is that when we reach about the 10-year mark, somewhere between 1 in 10 and 2 in 10 patients require that they find that they require some kind of additional procedure, and that can sometimes be a change of implants or it might be a repositioning of the current implants. But certainly the implant makers nowadays normally provide a lifetime guarantee with their implants, and that usually means that if you had to have implants changed at some point, that they would either pay for the implants and possibly contribute something towards the cost of surgery as well. It's really important when you're choosing implants that you make sure that you're happy about the surgeon that's performing them. In the UK, all breast implants have to go through a rigorous kind of safety assessment process. And similarly across the whole EU, there's very close analysis of breast implants and of any problems that might occur with different implants. In terms of safety from breast implants, One of the things that's become more talked about recently is something called breast implant related cancer, or adult large cell lymphoma. Now, this is a very rare disease. So to give you an idea, if you have breast implants put in, the rate of this type of cancer is between 1 in 10 and 1 in 20,000, compared to the rate of standard or more typical breast cancer in an average woman would be about 1 in 7. Now, looking at that type of cancer, there's definitely a difference between the surface of the breast implant, and we know that the cancer is more closely related to breast implants that have a very rough textured surface. So the tendency nowadays is to try and choose an implant that either has a smooth surface or has a less aggressive texture when placing it into the body. And the data seems to suggest that those implants are associated with a far lower risk of this breast implant related cancer. But on the other hand, it's important to remember that this ALCL that I'm talking about is normally well treated just by removing the implant and the capsule around the implant. And the important thing is that you have a surgeon who makes it clear to you that once you've had breast implants put in, if you were to notice, for instance, swelling of your breast, maybe 8 years or more down the line, you must get in touch with a doctor to have that assessed. In terms of breast implant revision surgery, the most common thing that we see is capsule formation. Now, everybody, when you have a breast implant put into your body, or any kind of implant, your body will create a capsule around that, and it's just your body's way of walling off what is effectively a piece of foreign material inside it. So that's normal. In some cases, however, that capsule can become hardened or thickened, and that could be a bit uncomfortable for ladies. There's a couple of things that can help with that. One of them is vigorous massage, and there's certain techniques that you can use. But unfortunately, usually what happens is they require a revision of the operation and division of, or removal even, of the capsule. So removal would be a capsulectomy, and cutting the capsule from the inside to soften things would be a capsulotomy. Now, the capsule itself, the main thing that you can do to prevent it is to take great care when you're putting the implants in to reduce the risk of infection. And I do several things, many surgeons are the same, but unfortunately not everybody. One of them is I use an antibiotic wash around the implants and inside the breast before we place the implants. The other thing is that we cover the nipples to make sure there's no shedding of material from the nipples, which can cause infection. We change our gloves and we re-drape the patient before we put the implants in. And we use a no-touch technique using a special, almost like a cake icing funnel to place the implant inside. But certainly capsule formation and capsular contracture can cause revision, can subsequently lead to the need to revise implants at some point. The other thing is that although implants make the breasts appear more youthful and larger, we can't stop the aging process. So as you go on in life, you can get some droopage of the breasts, as everybody does, and that would affect people with implants similarly. But there are options to correct that and to tighten up the breasts or perform an uplift or a breast mastopexy at a later stage to try and improve the appearance later on. In my practice, a typical cost for breast implant surgery would be around £5,000 or just under that. Revision surgery generally is more expensive, so normally that would be £5,500 or more than that. But as I mentioned earlier, if you've had breast implants put in and there's a problem with those implants, quite often the manufacturer will be willing to either contribute new implants or to contribute towards the cost of the surgery. And some manufacturers quite often provide new implants and £1,000 towards the cost of revision surgery. But it's a good point, because it's important that if you're getting breast implant surgery done, you don't just think about the immediate cost, but you think about the possibility of requiring revision surgery later on down the line. And that would normally be maybe 10 to 15 years afterwards. But as I said, not everybody requires breast implants to be revised. advised. And the hope would be that you would have a good result from your initial surgery and that that would last you for a long time.